My name is Sharon Risher. This is Nursing 325. This is my neurological assessment. Knock on the door. Wash my hands. Hey, my name is Sharon. I'm with the University of South Alabama College of Nursing. You mind if I do a neurological assessment on you? Is it okay if I video you? Okay. Would you mind standing up for me? Okay. First, I'm going to check his appearance. His posture is erect. He is well groomed, good hygiene. Next, I'm going to check his behavior. Patient is alert. He is not smiling at the moment. Just straight face. Are you having any depression or anxiety? Okay. And if he was, I would do the proper assessment screening tools. Next, I'm going to check his cognitive ability. Can you tell me your name?
John Risher.
Okay. Can you tell me where you're at?
In my living room.
Okay. Can you tell me the time of the day?
Should be around 8:30 that night.
Okay. All right. Next, I'm going to test recent memory. Can you tell me what you last ate for supper?
Pizza.
Okay. Now, remote memory. Can you tell me who the president was before Donald Trump?
Before Donald Trump was the old white guy. I can't remember his name. Biden. Yeah.
Okay. Next, I'm going to test his judgment, in his thought process. For abstract thinking, can you tell me the meaning of needle in a haystack?
It's really hard to find.
Okay. Now, we're going to test your judgment. So you got pulled over by a cop, what would you do?
I would pull over.
Okay. What is your future goals in life? Job goals.
Make a lot of money.
Okay. All right. Now I'm going to start with the cranial nerves. We're going to start with cranial nerve number 1, which is the olfactory nerve. So I'm going to get you to check your patency of your nose. If you'll put one finger on one nostril. All right. No. Okay. Now do it with the other one. Okay. Now I'm going to test his smell. Close your eyes for me. Close one nostril. Smell. What is that?
Smells like peppermint.
Okay. Now close your other nostril. Keep your eyes closed. Now smell.
That smells like hand sanitizer.
Okay. The cranial nerve number 1, his olfactory nerve is intact. You can open your eyes now. Now we're going to check the his cranial nerve number 2, which is the optic nerve. The way we do that is usually by a Snellen chart, which you would place the chart 20 feet in front of the patient. Like say they have 20 feet, that means they can see at 20 feet what the normal eye sees at 50 feet. But I don't have this one, I have a handheld screener. So I'm going to place it 14 inches in front of him. Tell me what the lowest line you see.
PEZOLCFTD.
Okay, that is. He's got 20/10 vision, so he can see at 20 feet what the normal eye can see at 10 feet. Okay, next we will test cranial nerves 3, 4, and 6. Cranial nerve number 3 is the oculomotor nerve. Cranial nerve number 4 is the trochlear nerve. Cranial nerve number 6 is the abducens. I'm gonna do that is, cranial nerve number 3, we're gonna check for perlac. So I'm gonna first, look at his eyes. I'm gonna say they're a 6, and they are round, so his pupils are equal and round. Now I'm gonna check reactive to light, and that's direct and consensual reaction. So I'm gonna go on the right side of the eye. It does dilate. Yeah, I'm gonna dilate. Now I'm gonna look again and see if the other one. Okay, so both eyes do have direct and consensual to light, so reactive to light as well. Now we'll check accommodation. If you'll look at an object if you look at a cross on a wall. Okay, with accommodation for further objects, his eyes will dilate, and closure objects, they will constrict. Now we will check for convergence. Okay, if you will look at my finger. Okay, his eyes did converge at the axis. So that's cranial nerve number 3, the oculomotor, and cranial nerve number 4, the trochlear. Now we're going to check abducens, which is the parallel tracking. Let's look at my pen. Okay, no nystagmus noted. He did have the parallel tracking, so he was able to track it. Now, he didn't. Okay, so cranial nerve number 6, abducens, is intact. Now we will check the cranial nerve number 5, which is the facial nerve. So first off, I'm going to check his jaw. Okay, jaw is fine. All right, hold it. Nope, clench your jaw. Clench it. Okay. So the motor part is intact. Now I'm going to test his sensory portion. I'm going to touch 6 places on your face and you'll just say now when you feel it.
Yep.
Okay. So cranial nerve number 5, motor and sensory, is intact. Now we will move on to cranial nerve number 7, which is the facial nerve. All right, I'm going to let you look at me. I'm going to let you smile. Puff out your cheeks. Frown. Okay. I'm going to get you to close your eyelids for me. And don't resist me opening them. Okay. Now, cranial nerve number 7, the motor portion is intact. And at this time, I would check for the anterior 2/3 portions of his tongue by placing something salty or sweet and getting him to identify. So cranial nerve number 7 is intact. Now we'll go to cranial nerve number 8, which is acoustic. So I'm going to stand in front of you, get you to cover one ear, and I'm going to whisper something. You got to see if you can know what I'm saying.
Hello.
Okay. All right, try the other ear.
Football.
Okay. So cranial nerve number 8 is intact. Now we're going to go to cranial nerve number 9 and 10. Cranial nerve number 9 is glossopharyngeal. Cranial nerve number 10 is the vagus nerve. With glossopharyngeal, we're first going to. All right, I'm going to get you to open your mouth for me. Stick your tongue out. Okay, uvula is midline and intact. I would also, I don't have it with me, we would get a tongue blade and check his, we would elicit his gag reflex. We would also place something on the posterior 1/3 portion of his tongue. And at this time, cranial nerve number 9 the glossopharyngeal and cranial nerve number 10, the vagus nerve, is intact. Now we will move on to the cranial nerve 11, which is the spinal accessory nerve. So we'll get you to just push against the hand. Okay. All right, now I'm going to check his shoulder. Okay. It's a lot stronger than I am. So cranial nerve number 11, the accessory muscles is intact. Now we're going to check cranial nerve number 12, which is the hypoglossal. We'll get him to stick out his tongue for me. Okay, tongue is midline. Okay. Now I'm going to get you to say light, tight, dynamite.
Light, tight, dynamite.
Okay. Cranial nerve number 12 is intact. Now we're going to check for his balance. I'm going to get you to walk, step over here and walk to the wall for me. Okay. So his gait is steady and smooth. All right, I'm going to heel to toe and walk towards me. Okay. All right, his rhythmic, no swaying noted. All right, stand back up. I just one more thing. All right, hands by your side, feet together. All right, close your eyes. I'm going to have a patient stand like this. I'm going to keep them. All right, no swaying is noted. So he would have a negative Romberg test. What am I missing? Okay. All right. I'm gonna let you have a seat for me. Okay. All right. We're gonna check for sharpness and dullness. Okay. This is gonna be sharp. That's gonna be dull. Okay. Close your eyes for me.
Sharp. Dull. Dull. Sharp.
Okay. So he was able to distinguish between sharp and dullness. Now I'm going to check for his reflexes. First off, I'm going to check his bicep reflexes. He did jump. Okay. 2+ reflexes on his biceps. Now I'm going to check his triceps. Loosen up for me. Okay. Alright. 2+ reflexes on his triceps. Now I'm going to check his brachioradialis. Okay. Alright. 2+ on the brachioradialis. Now I'm going to check his patellar leg straight. Okay, does have movement and there's 2+ on his patellar. I'm going to check his Achilles now. Okay, 2+. Alright, now I'm going to check his Babinski reflex.
That tickles.
Okay, negative Babinski reflex. He does have 2+, 2+ on his degree or range of motion. During this process, I was also checking the Glasgow Coma scale. which the highest score you can get is a 15, lowest is a 3, and anything below 7 would mean coma. You received a 4 for eye opening because your eyes were open the whole time. You received a 6 for the motor response because, of course, you were able to do everything I asked you to do. And you received a 5 for verbal response because you talked to me the whole time. So you received a total of 15. And this concludes my neurological assessment.